Okay, everyone, welcome to this month's session of the Canadian Transfusion Trials Group Research Methodology series. And this month, we are very privileged to have Dr. Keyvan Karkouti join. And Keyvan was appointed as the Chief of the Department of Anesthesia and Pain Management for Sinai Health, University Health Network Women's College Hospital in December 2018, has served as Deputy Chief at Toronto General Hospital since 2011, and has had made impactful contributions to the clinical research and education pillars of the department. He has held privileges at Mount Sinai Hospital since 2017, and has practiced at UHN, Women's College Hospital in CAMH. He obtained his medical degree from the University of Toronto in 1990, followed by an anesthesia residency and a fellowship in anesthesia at St. Michael's Hospital. He also holds a Master of Clinical Epidemiology and Healthcare Research and Health Administration from the University of Toronto, and completed the Rotman School of Medicine Leadership Program. He is a highly respected academician at the University of Toronto as a professor, and served as Vice Chair of Innovation and Research and Chair of the Promotions Committee in the Department of Anesthesia from 2016 to 2018, with the cross appointments to the Institute of Health Policy Management and Evaluation, as well as the Interdepartmental Division of Critical Care Medicine. And he has certainly been a incredibly valuable collaborator and colleague to the transfusion medicine community as well. And he will be speaking to us today on the challenges of getting money for your trial idea. So Keyvan, the floor is yours.
Thank you very much, Jacob, for that really kind introduction. I think the partnership with transfusion medicine has been amazing all around. So I'm just going to share my slides. Sorry. There we go. Good. Everybody can see that?
Yep.
All right. Now, there are people on this call who know much more about this than I do right now. So it's still kind of you guys to invite me, and hopefully I can bring some input into this issue. But I'm hoping this will be kind of a interactive round. So I don't think I can actually follow the chat. Yes, I can. So I'm going to open up chat, and as things come up and you have ideas that I'm missing, please put them up so people can see, and maybe we can add it to the next one. Let me just, excuse me. Okay, there we go. All right, so just to get started, my disclosures, I am by no means an expert in grant writing, but I can offer some opinions and hopefully ideas based on my personal experience over the past, I don't know, 25 years or so trying to get grants. And also some reading in terms of how to improve myself as a writer and grant writer, but generally as a writer in general. Bottom line is there is no foolproof formula for writing grant applications. Like everything else, I think it's at times it's better to be lucky than good, but being good definitely helps you to get lucky when it comes to grant applications. So what is the goal? Obviously, the goal is to write a grant application that has a reasonable chance of success. So there's no foolproof way, but you can absolutely improve your chances of success. And there's two components to this that I think are equally important, but we don't fully, for the most part, appreciate the importance of the two components. One is to convey a clear and persuasive argument in your grant application that advances a robust and high-impact research proposal. Now, the second part, I think, comes much more naturally to us when somebody asks, what's a good grant application? But I think the first part is just as important, if not more important, because without the first part, you're not going to be able to convince people that you do have a high-impact research proposal. So I like to divide it up into the science and the writing. And beginning of the talk, I'll talk about the science mostly and how you can kind of make your grant application illustrate the point you're trying to make there, but spend the last part talking about the writing, probably in a way that most of you haven't thought about. And I have a really good reference book that I would encourage all of you who are writing grants to buy and read, but I'll get to that in a little bit. So two components, science and the writing. The first few slides, I'll talk about how the science part can be scored higher. So it's just going to be a bunch of point form things going through highlighting the fact, highlighting things that might increase your score or decrease your score depending on how they come across. So I think the most important thing is you've got to have a clear significance and importance of the work you're doing. And in line with this, I think significance and importance is very subjective in many ways. It's, what's important to me in my field is not going to be important to you or somebody else's field. And our grants are not read by people who are interested in my work, right? They're read by people who are essentially, they're educated, but they may be lay people in your specialty. So what you've got to be able to do is convince them that it's significant and important. And I find that you can't do that unless the question you're trying to answer is important to you. You're finding it interesting. You think it's a big clinical issue in the work that you're doing. As clinician scientists, essentially, I think that's what we bring to the table that pure scientists or PhDs who do nothing but research really don't bring to the table, which is we can come up with the right question that's important to us and to the system, society, et cetera, and is interesting to us, and therefore we can make it clear, and that I think makes it much more likely for you to be able to make an argument that it's an important question that needs to be answered. Then obviously interest to you is important, but it's not enough. It also has to be impactful. There's got to be a problem that you're trying to solve that impacts patients or the system. And that impact is obvious to the lay people or educated lay people reading your grant application. Now that's hard to do in many cases, to find that right question that meets both those criteria. It doesn't have to be a major impact. It doesn't have to be world changing, but it has to have a demonstrable impact. So if your research idea is just making an incremental contribution, it's going to be less likely to be funded. And in anesthesia anyway, for example, the good examples that I think of is, for example, looking at different doses of medications that we might be using intraoperatively that might have a small impact on nausea and vomiting post-op. That'll be a lot less likely to fund as opposed to something that has a bigger impact. In transfusion medicine, obviously, that's a different question, but that's important as a second point. Now, we always say it has to be novel. I put novelish in there. I mean, if you go back to my career and see the novel stuff I've done, there probably isn't that any. I think if your aim is novelty and something that hasn't been done before, I think you're going to be very disappointed in how much you can advance. I think ultimately, as I'll get to in the next part of the talk, the whole thing about science is it's a constant evolving thing that we kind of join late, and each of us join late and leave early. So we contribute to it, but it's very unlikely that any one of us is going to have a completely novel thing that hasn't been addressed before. So you've got to have to show where you're adding to the question or to the answer, what part of it you're answering. But to expect everything to be novel, I think is too much, but you definitely have to have some novel components. It needs to be innovative as opposed to a fishing expedition. One of the comments I hear on grant review is for low scores is that this is just a fishing expedition. And I think that goes to the problem of submitting something that you haven't done the background work for enough. And the critical care group has a nice slide that they have in terms of what it takes to be ready to submit a grant application for an RCT, for example. And that basically means you've got to do multiple steps before you get to that, so it doesn't come across as a fishing expedition. So you've got to have strong baseline data from observational studies. You've got to have a meta-analysis or a systematic review done that shows that, yes, this is an issue. There is a signal that you're looking at. Obviously, the top three things still apply. And then a pilot study, and then you can get funding for a small funding for pilot study, but you do need some internal support probably for that. And then you're ready for the big study. So then it won't be a fishing expedition. But if out of the blue you have an interesting question, you haven't done any work in that field at all, you come up with a proposal, it's going to be considered a fishing expedition. So I do say innovative is important, but ultimately I think it's more into how much preparation work you've done to eliminate the criticism of this being a fishing expedition. You have to have clear rationale and hypothesis, and it's surprising how many grant application I read where, that seems pretty clear that you should have that, but it's hard to decipher what the hypothesis or the rationale, especially the rationale. And that goes towards writing style and techniques, and we'll get back to that later. But don't underestimate the importance of this, especially because you've got to remember that people who review your grants are pretty busy. They get 10, 12 grants to review for any competition. And you want to make it as easy as you can for them. Related to that is your aims, and they need to be plausible and focused. So that's the rationale, hypothesis, and essentially the objectives of this study. And they need to, everything kind of has to fit together. I think where I've seen problems is where the objectives are either over-ambitious, that the design isn't going to answer them, or they're unfocused, they're not related to the rationale, and they're not separate. So they have 2 or 3 things. I mean, everybody tries to have 3 objectives for some reason. I'm not sure exactly why that's necessary. But then to do that, they become kind of interrelated and confused. So keep the objective simple, to the point, and aligned with your rationale and hypothesis. Very important, I think, is that you have to advance a program as opposed to a limited scope project to get high marks. And that goes back to doing the background work, having the, the pilot study, the meta-analysis. So you've got to be known as somebody who's advancing a program. Obviously, if you're a new investigator, it's different. If you are a new investigator, then the team becomes critically important. The team has to have a program that you're contributing to. You're not going to be able to stand on your own in a major grant or even a pilot study unless you have that programmatic approach. You could get lucky with limited scope projects, but I think the chances are much better if the project you're doing fits a broader program of your own or your team's. And I guess I just talk about this is kind of repeating the track record of you or the team, and then the preliminary work. So this is critically important to have that stepwise approach to a grant. I mean, we have a research in progress rounds for our staff, and we ask them to present to us their research projects before we assign resources towards grant submissions and so on. And the number of times I've had to tell our staff where they come with a good project that seems to be viable, but we refuse to provide internal support is because they haven't done the preliminary work. It's basically, this is an interesting question, I want to answer it, and therefore I want to submit a grant, whereas that's not going to succeed unless you've done all the background work, and that puts you in a position to do that. And I find it hard to convince people of that. So that's why it's kind of repeated here over and over again. The methodology needs to be feasible and clear, and make it obvious to the reviewers that you're going to have unambiguous results. As I mentioned, reviewers are busy. They have multiple other things that they're doing, multiple things. So the easier it is to follow the grant application, the methodology, and the more it's aligned with what they know. Methodology is like an RCT should be designed, and an RCT is expected to be designed. Observational study should be designed as they expected. If you're deviating from that, it needs to be very clearly communicated and explained. Otherwise, it will not get high marks. And one perfect example is blinding. When you're doing an RCT, everybody expects you to have a double-blinded study. And in many cases, that's not possible. And I find that a lot of applicants kind of gloss over that. Oh, this is going to be an unblinded study, without providing a strong rationale why it's not going to be blinded. And invariably, I mark that low. So, but whereas it might be a perfectly reasonable proposal and why you can't blind it, but it's not well explained. So not only do you have to, it's best to follow clear methodology, expected methodology, and when you're deviating it, you have to explain it properly why you're not following best practices or best methodology. I find a lot of grant applications, the statistics part is problematic for two reasons. One, there isn't enough statistics, or two, there's too much statistics. So why I've called it the Goldilocks principle of statistics. We have a certain amount of space in our grant applications, and usually it's reviewed by 3 people. 2 of them are generally content experts or design experts, and 1 of them is a statistical expert. And a grant application has to meet the needs of all those 3, and obviously they're not the same. So the statistical reviewer is going to focus a lot more on the powers, your proposed primary outcome, how you're going to answer it, whether or not it's appropriately designed to do that, and so on. The other reviewers are not going to have the same knowledge of it, but they still have a rudimentary knowledge of it. So it's important to convey enough information that the statistical expert is happy with it. And it doesn't really go over the head of the non-statistical reviewers, because if I get 2 or 3 pages of statistics and not enough on the rationale and background, you really don't get extra marks for the statistics, but you will lose marks for not laying out a strong rationale and other design aspects. So pay attention to your statistics. I don't think these days, in the old days, I used to do grant applications. I would write my own statistics for a section. These days, though, you do need a statistician to do that for you. And really pay attention to the power calculation. Make sure modeling is done for power calculations, and the assumptions for that are strong and supported with references and so on. So pay attention to the power, and then couple of paragraphs on the statistics, what your primary analysis is, and really you don't need more than that, I think, for most straightforward grant applications. Obviously, it's different if it's a purely exploratory, novel statistical design, things like that. But we're not talking about that kind of a grant here. This is more like a straightforward clinical trial or clinical observational studies. So pay attention to your statistics, get a statistician, do proper power calculations with assumptions tested and different modelings, so that they have no questions about the sample size when it comes down to it. So that's what I had on the actual scientific part of it. I know a lot of it was kind of based on experience, no references there, but I think these are important pitfalls that you can avoid that I've noticed to be problematic when I'm sitting on grant review committees or when I've received my own grants feedback. So the next section, as I mentioned, is going to be on how to write a grant. In my view, this is, I think, the more interesting part of the talk, what I've had the most fun learning about. And partly because I actually enjoy writing. And to me, getting a solid argument is a grant application is actually quite an enjoyable part of it. So moving on to the writing component, you do need a strong research proposal at the base. So unless you have all the other things that I talked about, no matter how good you write, it's not going to get funded. But even if you have that, but you write poorly, you're still not going to get funded. So which is the 2-component part of the issue that I was talking about. Now, this is the book that I mentioned earlier. This is a really good book. It's called Story, Not Study. It's divided into 30 brief lessons that you can flip through as you're writing. Each chapter is a standalone chapter. I'm going to go over a couple of the things that's in this book. But overall, I would strongly urge anybody who's writing grants or writing papers to get this book. I have no conflicts with this. I did not write this book, but I do buy it and hand it out to my students all the time. It's primarily designed, or the goal here is to write papers, but it really applies just as much to grant writing. And normally I don't do this, but I took this straight from the preamble to the book. And what they propose is that our approach to writing papers or grants should be different than what we used to as scientists and clinicians. So I'm just going to read what they've written because there's no way I can do a better job. So instead of talking about writing up a study or a grant application, we focus on telling a story. Great research papers like stories are compelling, memorable, and persuasive. They grab and hold readers' attention, increasing the odds that the research findings will reach and influence their intended audience. Make no mistake, the notion of story here does not imply fiction. Good research stories must be accurate, scientific, and open to critique. Persuasion does not equal deceit. Our storytelling metaphor is not an invitation to gloss over inconvenient results or to make outlandish claims about impact. Rather, it's a framework for crafting papers so that they resonate with their target audience. Now, there's a lot of important things in there in this simple paragraph that I find to be problematic when I read a lot of grants. One is, for example, just to pick a couple of things, you don't want to make outlandish claims about impact. I can't tell you the number of grants that start off by setting a rationale for an important problem, but then going on to finish by there's an urgent need for us to address this, or patients are going to die, kind of a thing, which, we know most times it's not actually true. There's usually no urgency. It's part of an ongoing process and so on. So you've got to tell the story. You've got to make it compelling, but you can't really deviate from being a scientist and adhering to the scientific principles. So this is the approach that they're taking when it comes down to writing a paper or a grant, and I think it's a really great approach. So they're getting into some specific tips about writing grants. So number one, it's a very challenging skill. English is my second language, but I've been doing it for a long time now, and writing has always been an interest, but it sometimes takes me a whole, several days to get a couple of paragraphs of a grant application going. Partly because there's a lot of constant refinement and relearning and development. And whatever I write, it invariably goes multiple revisions, and oftentimes the end result is completely different than the initial startup. Which goes to my rule number one, means having no ego. And by that I mean I apply that to my clinical practice and also my research practice. You've got to be able to accept and act on criticisms. You've got to be able to take on rejections without taking it personally. Going back to our research in progress rounds, I find it hard to get people to actually criticize presentations strongly because they're worried about how other people are going to take it, or they might come across as being overly negative. But I think unless you accept this fact, you're not going to, I personally wouldn't have advanced if I didn't, initially it hurts, but you've got to accept that sometimes your ideas are just not worth advancing. Sometimes you've got to change it a lot to make it worthwhile. And sometimes your writing is not good and you have to redo it. So keep that in mind. Writing is hard. Being criticized for it should be good as opposed to be seen as a negative. And obviously it helps to enjoy writing, but I'm sure a lot of you guys don't. But I think that quote is pretty apt. Writing is thinking. To write well is to think clearly. That's why it's so hard. Although nowadays with AI, I don't know how this is going to change, but personally, I don't use AI in my writing. So to me, it's still a process of thinking and helping me think. So that's why partially I think I enjoy it so much. Just a little pep talk to myself whenever I get stuck in a writer's block. The pep talk is that it's worth the effort. To me, being able to communicate an argument that's relatively novel, that hasn't been communicated the same way before, in a way that somebody reads it and it's cogent and convincing and appreciated, I find that very satisfying. So when I take a grant application, give it to somebody else to read, and they get it, I think then to me that effort of a month of writing or something after doing all the prep work was well worth it. The other thing is, once I've written a grant, with help, obviously, these days nothing's done alone, and it's submitted, I automatically prepare myself for a rejection. Because it's great if it's funded and it'll be a positive surprise, but if you're not prepared for a rejection, you're basically putting your work on hiatus for a few months until you get it back. Whereas that's a good time where you could actually be working to improve the proposal for the next submission, which you get a rejection. And then you'll be prepared to quickly submit it in. So no grant is perfect. And once you've submitted, there's always room for improvement. There'll be more feedback. So be prepared that it's going to be rejected. Keep working on it so that if you do have to resubmit it, it's going to be done better. And then if it's funded, then it's great. Congrats. But now obviously you must do this study. But to me, actually, that's the least fun part of a research project. To me, the fun part is coming up with the argument, writing it down, putting the grant application together, and then once the study is done, the analysis and writing the paper, which then you go back to telling the story. So the grant is the beginning of your story, and then the paper is finishing the story, at least that part of the story that you're working with. And to me, those are the fun parts. Moving to grant writing tip number 2. So you have to include the details, but you must also focus on the big picture. So as they say in that book, it's a scholarly conversation. As I mentioned, you're kind of joining it in the middle and you're leaving it before it's ended. So you've got to kind of fit your argument or your proposal in that conversation. Nothing stands alone by itself. And unless that comes across clearly, it's not going to be understood by people reading the grant. And you've got to show what it adds to existing knowledge and why it matters. And if you do that well, as I mentioned, you don't have to have a completely novel idea. It doesn't have to be that big an impact into the conversation as that I think cartoon below illustrates it. If you do the writing well, and the question is valid, then you can probably convince people that it's worth funding. This is the most important lesson, I think, from that book that I've learned, which is hook your audience early. This is where the story part of it. And here we're talking about the first paragraph. Now, when we're initially taught how to write essays, we're taught about having this inverse triangle where you start general and then you go basically, then you narrow it down to the area of focus and then you come up with your question and then the next few paragraphs. So that's 3 paragraphs or so in itself. What they're proposing here is to completely flip that around and grab the audience early, hook them by the methodology that they're going to go over, and I'll go over that. So as I mentioned, the reviewers are busy again, and unless they're hooked early, they're going to get bored. Sometimes, you have to get 1.5 pages into a grant to figure out where the problem is, what the significance is, and by then you've lost a lot of interest, and it's unlikely you're going to get marked where you need to be marked. So this is very difficult to do, but in this book, there are strategies to do it, and I'll go over one of it next, I believe. What they call here is the problem gap hook heuristic or methodology. So as I mentioned, the traditional inverted triangle introduction doesn't really hook the audience. And it's good for people who are experts in the field or really not experts and are trying to learn. But when you're pitching your proposal to a knowledgeable reader, then that strategy doesn't work. And what they propose here is something different. And they say that you should start by stating the problem. So the problem is whatever it is. Then you kind of add 1 or 2 lines on what we do know about the problem. And then more importantly, state the gap in knowledge in terms of what we don't know about the problem. And then highlight why what you're doing matters. And you can do that all in 1 paragraph. And if you do that in your first paragraph, and then the next few paragraphs, you expand on these, I think that's a much better way to hook the readers in terms of quickly understanding why your project is important, and therefore much more likely to get a higher mark, I think. So just a couple of examples on this. So instead of a topic sentence, they say start with a problem gap hook. So a topic sentence doesn't really belong there, and it's quite different than the way I used to think when writing a grant. Here's an example. So these are straight from the book, by the way. Team communication plays an important role in patient safety. All right, so that's a nice topic sentence, but doesn't really excite anybody, and it's not really novel information. What about this, though? So here you're turning that into a problem. So adverse events resulting from error happen at unacceptably high rates in hospital, and ineffective communication among team members is often a contributing factor. So that really highlights a nice problem. It's obviously a lot more words than just having a topic, which goes against what I've been taught initially, which is the shorter the better. Sometimes it's not, and it's a perfect good example here. But as you can see, in the first sentence here, you would have highlighted an important problem that otherwise you would have wasted by just a topic sentence that doesn't really have an impact. Here's a more expansive paragraph that I think illustrates it nicely. So this is a typical way of how we would start off a grant. So leadership is increasingly recognized as an important competency for physicians. At the same time, collaboration is growing as a value and expectation of healthcare delivery. What has not been explored is the relationship between leadership and collaboration in physicians' practice. The purpose of this study is to explore this relationship by asking, how do physicians experience leadership and collaboration during their daily team interactions? That's a pretty good opening paragraph, but it doesn't highlight what the problem is. It alludes to it. It relates to leadership and collaboration and impact of that, but really doesn't explicitly state what the problem is. So this is what they propose would be more impactful. So the first sentence, leadership and collaboration are highly valued and potentially conflicting competencies in medical practice. So that's a clear description in one sentence of what the problem is, that they're highly valued and potentially conflicting. So leadership and collaboration don't go hand in hand, they're in conflict. And then they go into, okay, what's known and what's not known about the issue. So where's the gap? So while there's been attention to leadership and collaboration individually, so that's what's known, little attention has been paid to how they interact. So that's what's not known. And then there is the hook, or the importance, with physicians experiencing increasingly formal expectations that they lead and collaborate effectively, we require systematic knowledge about how these competencies play out in clinical teams. So you got the problem, you got the gap, and with a nod to what's known, and then you've got hooking the readers in terms of what you're going to accomplish and how you're going to address the gap. So it's the same number of words. I think it's, but if you read them again, I think most of us would agree that the second one is much more engaging than the first one. So when I'm writing anything now, a paper or grant, this is my first paragraph. Takes a long time to actually finalize, and that's because I'm trying to put it in this context. Another important thing that we've tried to implement in our department is that our scientific associates and our PIs shouldn't work towards a grant deadline. Because invariably what happens is by the time you get to the grant deadline, or near the grant deadline, you find that the things you'd assume would be done have taken a lot longer. You're going to be submitting something that's not optimized. So my thinking is reverting that on its head and say, we should be writing grants all the time. And when it's done, then you see, okay, I'm going to meet this deadline and then submit it to that, as opposed to working that way around. Because the flow invariably, as I mentioned, takes longer. First, you got to get everything on paper, then you have to let it sit, percolate in your mind, then do your first review for organization, the argument, and the logic. Sit again, read it again, make sure that argument and logic makes sense. And then once you've done that, go for clarity, style, and flow. Again, let it sit. Review again for both of those things. But then 9 to get into spelling, grammar, and punctuation. So that's a lot of reviews and letting it sit. And I don't know if you're anything like me, you think you have a great paragraph or a great few paragraphs, and then you read it again a week later and you think to yourself, what were you thinking? And essentially end up changing 80% of it and go through that several times. So it becomes an iterative process. And I find that if you rush that process, at the end of it, you're going to have something that's not going to be clear. You're going to lose marks based on the stuff we talked about in the beginning. And then you're not going to have enough time for spelling, grammar, and punctuation. And you might think that's not important, but nothing really annoys the reviewer more than finding those things, because the message there is that you didn't take the time to make sure this was finalized for a submission, and that even if it's a great study, that kind of rubs people the wrong way. And then once you've done that, then you have to have it reviewed by a content expert, an editing expert, and a lay expert. So all of those things all three are important. The editing expert goes back to what I just mentioned about spelling, grammar, and punctuation. Content expert to make sure that your story, what you're proposing falls nicely into that story, that's the program that you're trying to address. And then a lay expert to make sure that the people who are going to read it understand your arguments. So they're knowledgeable lay experts. So that, if transfusion medicine is not their expertise and they read it, they get it. So it's important to have all those three people read it. And obviously that takes time to get their feedback and then implement their feedback into the program. So keep that in mind. If you're working towards deadlines, I think it's a lot less stressful if you don't work towards deadlines and just continuously to work on the projects that you're working on. I mentioned this earlier: anticipate and address criticisms, but justify choices that deviate from norms. It's a lot like answering an oral exam question, I think, that if you're oral college oral exam, that if you're answering something that deviates from norms, you've got to defend it, or you're going to fail that oral exam. The same thing applies, I think, to grant writing. So the important things that I find people don't pay enough attention to are blinding, outcome measures, your primary outcome measure. What's the data? Is it validated? Is it accepted? The follow-up period. Why aren't you following patients for what other studies have followed them for? Going back to outcome measures, is it a composite? Does the composite make sense? But it's really important to make sure those are addressed properly. And explain where you're deviating from existing best practices or accepted outcomes and so on. Highlight the strengths of the study, but also be forthright about weaknesses and challenges. We don't spend enough time in our grants highlighting the weaknesses and challenges, and that comes across when the reviewers read it. So I mentioned the primary outcome, the composite outcome, especially composite outcomes. If you're going to use a composite outcome, it's got to make sense and validated. And if not, what is your rationale for using that? Why you're not doing fully blinding? Is it cost? Is it impossible to do? Is it just because the study will be done faster? I mean, some of those are valid reasons, some of them are not valid reasons. The data collection, why you're collecting what you're collecting and why you're not collecting what you're not collecting. Sometimes you get things where the patients are asked to do, you're going to ask patients to do multiple surveys and like a very onerous outcomes, and the reviewer is asked, why do you need all of that? And other times it's the exact opposite. And then the follow-up I mentioned. This is really important. I don't think people pay enough attention to this in terms of potential biases and what you've done to address those biases. So a section on your grant should be on this, I think, and you should go over the ones that are related. I've just listed some biases here. Depending on the design, they might be relevant or not relevant, but make sure that, for example, if you aren't doing blinding, how you're avoiding the biases that might come from that. And yeah, so that's that. And then just a bunch of things that irritate reviewers that I've listed here. So budget. I think we're all used to having the budgets cut back. So we all now, I think, kind of expand the budget in anticipation of that. But sometimes they're ridiculous what people ask for, either too much or too little. If it's too little, they're going to be worried that you're not going to be able to do this study. So they're not going to fund it. If it's too much, they're going to basically either cut it back a lot if you haven't defended it, which means you might not be able to do this study, or they might just overall reduce the mark because they think you're just asking for too much. Follow all the instructions carefully. For example, one area, if it's a resubmission, if they've asked you to put the previous comments and answers in, put it in, don't reword it. If they've asked you to summarize it, do it. So pay attention to all the instructions. The summary page, I think, is critically important that people aren't paying enough attention to. when you're in a grant review, so 3 people read the primary grant, but everybody else marks it. And usually they just read the summary. And if the summary is not clear, then chances are you're going to get marked lower than the consensus as opposed to higher. So pay attention to that summary. I think that's an area that people aren't working on enough. Right, for both experts and non-experts, as I mentioned, the reviewers aren't going to be necessarily content experts. I think this is less of a problem now, leave white space. It used to be that I would read grant applicant, mine would be the same, where we would put as much as we could in the pages, but now I take a lot more, I try to leave a lot more white space between paragraphs. No fancy, not a lot of italics or bolding or anything like that. So if the argument is well outlined, you really don't need to do fancy fonts and things like that to make things stand out. It should stand out because of your writing as opposed to tools like that. If you're going to embed figures and tables, don't make them so small that they're impossible to read, and take the space and make them understandable, but only include them if they're going to save words. Otherwise, you're just taking too much space. That's not going to add much value to the grant. One thing that really bugs me is acronyms that I'm not familiar with, that are not routinely used. So it's generally, it doesn't save that much space. Anything more than 3, 4 acronyms in a grant, I think gets confusing for reviewers that are not content experts, especially if they're weird acronyms. So stick to using the full word if it's not a commonly accepted acronym. Be persistent, but change course if you must. And I think Jacob liked this quote before, but it's from Chris Stapleton, but nobody wins afraid of losing, and the hard roads are the ones worth choosing. So initially, when I started my research career, it was in airway, and then I switched to sleep disturbances after surgery, and then I ended up in my current focus that's been ongoing for a long time. But I had to change paths twice before getting to something that interested me and was important enough to get funding and change practice. And that happened because I submitted grants, the reviews were negative, and there was nothing that I could figure out how I would change it or convince them of its importance. And eventually I accepted it. It didn't take too long, a couple of years for the first one and a couple of years for the second one, and changed course as opposed to being pig-headed and continue and say, no, the reviewers are wrong. This is important. I'm going to keep doing it. At some point, you've just got to say, no. Let's change course, and hopefully we'll succeed. And with that, I'm going to stop with the motivational penguin at the end.
Awesome. I like that motivational penguin. That's still a great song. Glad you kept that in this year. It's a great line. So we have lots of people who signed in for this talk, and I think showing the interest. If I could just start with one quick question, and I'll open it up to the audience. How big of a problem is it, for a grant writer? They've got the science right. Their writing is well considered and developed, but they've picked the wrong grant. Like, how much of an issue is that you just applied, for the wrong funding source for your particular project?
Are you asking me, or did you say you want to open it up to the?
Well, I'm curious your opinion on that. Do people apply for CIHR grants for projects that are just not meant for CIHR funding, or do they go for smaller grants when it's, they should be looking for something bigger?
It used to be, I think, we used to think that, no, this is not CIHR worthy because it's too small or observational, but CIHR, if you hit the other check marks, which is it's important, it's a gap, and you've written it well and all of that, CIHR funds observational studies, pilot studies, systematic reviews. I think the importance is more relevant than the specific issue. There are obviously non-CIHR grants where you got to fit, for example, heart and stroke, you got to fit the criteria that they have. So if you submit something that doesn't relate, then that's a waste of time. PSI, I find it very difficult to know what PSI actually funds. It's very random. So we when we write a grant for CIHR, we also send it to PSI, and we also send it to Heart and Stroke if it fits the criteria and so on. So I would look at it the other way around. Write the grant that you want to write or the project that you want to move forward, and then see where it makes sense, and then submit to as many as you want, as you can, that fit the criteria.
Okay. Any questions from the audience for Keyvan?
Oh, gee, I see Jeannie on the line. I'm
I
sure
was
she
about to call out Jeannie too, actually.
we've done a lot of our work together, so she's I don't know, Jeannie, do you want to add anything? Anything I've missed out? Anything?
No, I think the one thing you've taught me is to remain positive and like enjoy the ride, like enjoy like the whole trip of writing the grant. It's not about getting the grant. It's about learning along the way, and it's okay to fail. And it's kind of like, you know, when you submit a paper, like you don't expect it to get accepted, no revisions. Like that's happened maybe once to me in my whole life. So you're expecting a rejection with some comments. Okay. And listen to the comments, address them all just like you would for a paper, and then resubmit. So like a rejection's not just a bad thing. It's recalibrate, redirect, change your messaging. The one question I would ask for you is like often I'm like out for a walk with the dog and I'm like, oh, I have to do that. So I find myself basically having to like walk around with like a little pad and a paper of, oh, fix this, fix that. You know what I mean? I don't know. Is the same thing happening to you where you're just basically, oh, I need to change that sentence? Like your brain is constantly thinking about the grant for like 6 weeks.
Yeah, no, absolutely. And I think going in terms of rejection, what I do now when I get comments or rejections, I just basically quickly skim them. Then I put it out of my mind for a couple of days because I find that helps me from getting upset or making it personal or thinking that they're completely wrong. And then after that, I find, oh, wait a minute, they had a point there. This is actually, a really good point. So I find a lot of people quickly jump on those criticisms and take it too hard too much. So I think that's a really good point.
I would also say that when I get rejected, I see it as a personal challenge, like to overcome the rejection and win. So I see it as, okay, like that's a challenge. It's like a stretch assignment. I can beat you. You know what I mean? And figure out how to resubmit and get that grant.
Lewis.
Yeah, so thank you very much, Kevin. This was a very practical, important advice. I have the luxury and I'm lucky to be learning with both of you, Jeannie and Kevin. But one of the things that is just more a comment. You mentioned that it takes a few days, many times for you to, or many time for you to, lots of time for you to write a few paragraphs. Same happens with me. Again, English is not my first language, so that is kind of, comforting to me to hear this from you, who have, very lots of success with the clinical trial. So thanks for that.
Yeah, thank you. No, absolutely. One of the things that sticks in my mind, I submitted a paper to a British journal. So it was a paper submitted. So obviously I'd spent a lot of time. And then they accepted it, except the editor sent it back to me about a third of the length that it was when I submitted it. And I looked at his revisions and I said, holy crap, this guy is an amazing writer. I mean, he was so much better than me. But, and he took the time to actually make the paper much better. So no matter how good we think we are or we've gotten, there are people who are like really talented in this. And if you have access to somebody like that, take advantage of them. Because I'm never going to be that. I know I'm never going to be as good as that guy or a girl or a man or whoever that editor was.
Actually, Kim, could I ask you to expand a bit on the whole concept of collaborative grant writing? I've seen this done a few ways. One where like one person sits and writes the whole thing and then sends it around to people and say, okay, what do you think? And make edits. Others where, someone says, I'll write this section, you write that section, you write that section. Do you have an opinion about which approach works better, or What's your usual style?
We do it collaborative, but not the way you mentioned. Usually what we do is have somebody take the first draft. Obviously, the sub-specialized part, like statistics, will be different. But in terms of the background and rationale, spend a lot of time on the hypothesis question, go back. So the way we do it, we have scientific associates who get assigned to projects so we have research in progress rounds. People who want to move projects forward present, they get feedback. And if the feedback there is, yes, this is worthwhile, then we assign resources to it. And one of those resources is a scientific associate whose only job is to help these grants move forward to submission. But we expect the PIs to write the draft of that, so the bones of the grant, and then go back and forth multiple times to finalize it. So it's collaborative, but not piecemeal, because for some other people might be different. I think that you need that overall frame of mind to be able to put a cohesive thing together, and for the background and the methodology, but then all the other stuff, expertise, EDI, all of those things we have different experts for that. So that goes to different people, statistics, EDI, things like budget and so on. But the main component of it usually is done collaboratively but going back and forth for the whole thing as opposed to each piece.
And do you bring in sort of like departmental or sort of like formal structural committee review for grant writing, or do you sort of have just the team that you put together for that particular project?
That's a really good, we don't have something, I think it's important, it's a good thing to have, like no grant goes out unless it's reviewed internally, but that's very resource intensive. So we haven't done that yet. But so people are allowed to submit grants, but the way we maintain control is by having that associate essays assigned to the project. So we know that when it goes in, when they're involved, it's high quality. And almost nobody really has gotten funding without that process here. So, and those essays are paid for by the practice plan, because there's no way you could get enough grants to support in the area that we're at anyway, having highly paid scientific associates helping with grant. So if you can convince the practice plan to invest, I think it'll be helpful, because I don't know about you guys, but foundation support is not that strong for anesthesia.
All right. Well, not seeing any other questions, we can prepare to adjourn. Thank you so much, Keyvan, for this really helpful and just practical approach to this. Just to remind everybody, we have a few more sessions for this cycle. So the June rounds will be on piloting the protocol by Shane English, who will be drawing upon his own experience talking about transfusion support for traumatic brain injury. Okay, with that, I think we can adjourn, and thanks again, Keyvan.
Thanks, everybody.